Good morning, Dr. Fuentes.
Good morning.
It is a pleasure speaking with one of Central Florida's leading healthcare professionals.
Thank you very much.
You are an internal medicine physician.
Yes, I am.
Please share with our audience what internal medicine is.
Yes, internal medicine is American Board Internal Medicine. That focuses more in preventive medicine. So what we do is screening, and the first time the patient comes to my office, they call annual physical. We do the screening for diabetes, hypertension, cholesterol, mammogram, and so forth.
That's nice to know. What type of healthcare issues are most common with your patients?
Well, it's too many. What we have to do is more importantly. The more important, the one we have to focus is the one in diabetes. Since we have almost 34 million U.S. adults with diabetes, we have to do that. 1 in 5, they don't know they have diabetes. So we have to focus on that.
And can you explain what is diabetes?
Of course. Diabetes is a disease, a long-term and chronic disease that affects us in this country and different places in the world as well. So what happens in diabetes is lack of insulin or not enough insulin come from the pancreas, and then sometimes they have different kind of types, the type 1, type 2, and gestational diabetes. So the type 2, which is the one in focus right now, is where not enough insulin. So what is insulin? Insulin is a hormones came from the pancreas. When you eat any kind of food, go to the stomach, go to the colon, and then become sugar. So the sugars go to the cells in every kind of the body. We have liver, muscle, brain, and we don't have the insulin, which is the key to open the door, and the sugar go inside. So we have a fuel, the energy. If we don't have that, the sugars go outside. And when it go outside, all the cells and all the blood cells that affect the heart, the eyes, and the kidneys.
Okay. What is prediabetes?
Well, what you say, pre is before diabetes. I like that word because we can treat it. We can prevent that to become diabetes. So what happened if the patient comes to me, we have preventive medicine, we do blood work, and we have the A1C. What is A1C? It's hemoglobin, they call sugar coated. So what happened, take the blood, and we measure the sugar 3 months prior of the test. For example, you take the blood today, and that measurement is 3 months before, prior, we take the test. For example, if it's pre-diabetes, between, it's the numbers, 5.7 to 6.4 is pre-diabetic. So it means there's a sugar that is too increased, and then we have to treat it.
Okay. What is the symptoms of pre-diabetes?
We don't have symptoms.
No symptoms?
No symptoms. We have some signs. Some people have with the darkness in the neck, in the axilla, and so forth. We assume they have diabetes. We assume they have pre-diabetes. We don't know until they take the test.
Can you prevent pre-diabetes into converting to diabetes?
Of course, yes. One of those is exercise. To do exercise, we encourage them is 15 minutes every other day. For a week, if you want to, but you can continue if you want. It's very important to reduce your weight in diet, exercise. Sometimes the age is very important. If this person have more than 45 years old, the risk is high. Even though you can take the patient screening before 45, you can see the patient is overweight, history of diabetes in the family is another risk.
And including all those factors that you mentioned, can you prevent pre-diabetes from converting to diabetes?
Well, that's the goal. That's the goal. If the patient follows my instructions and they give you diet, which we do in my office. For example, they call superfood, green beans, dark vegetables, broccoli, and also we have sweet potatoes, and we have dairy-free milk, and so forth. We have a list that we can offer them.
So I've heard the phrase the silent killer. What is the silent killer?
The silent disease they call hypertension. The silence to death also, that's all they call. It's very important. We have to, that's part of the screening, prevention medicine. The patient comes, my MA medical assistant take the blood pressure. What the normal is 120 over 70, 112 over 70. 125 to 140 is called elevation. 145 up, hypertension type 1. So if you have a hypertension, more time, more than sort of about 10 years, you can affect the heart, the kidneys, and the eyes as well.
And what is considered stroke level high blood pressure?
If you have a blood pressure 180, 160, at least for 1 year without treatment, the risk of death is very high. You have to go to the emergency room to be treated with hypertensive medication. Thank you for the questions. I encourage everyone to come to the doctor. We, in our office, we do annual physical. We do screening, such as check for prediabetes, diabetes, hypertension, mammogram, colonoscopy, referrals as well. We are open to everybody, and Orlando Primary Care, and phone number 407-601-5308. We are located in Orlando, 11616 Lake Underhill, Suite 205.